So we are talking about rheumatoid arthritis. It is a chronic autoimmune disorder affecting the peripheral joints. So it is a symmetric polyarthritis of the peripheral joints. Etiology, it is unknown, but it has a genetic predisposition. It is seen more in monozygotic twins than the dizygotic twins, as well as more in the first degree relatives. It also has a connection with the Epstein-Barr virus, parvovirus, and it has a relation with the HLA DRB1 alleles. The other risk factors are females and smokers. Pathology, there is chronic inflammation, granuloma formation, and joint destruction. So as you can see, this is the joint capsule where and there is thickened and inflamed synovial membrane. There is bone and cartilage erosion, inflammation with inflammatory cells, and angiogenesis. Along with it, there is thinning of articular cartilage. So coming to clinical features, there are two main things. That is articular features and extra-articular features. Articular features include middle-aged woman, 40s or 50s. Morning stiffness is present, which subsides within an hour. There is insidious onset of symmetric polyarthritis. It affects the metacarpophalangeal joint, proximal interphalangeal joint, wrist, knee, elbow, ankle, and metatarsophalangeal joints. The distal interphalangeal joints are usually spared. Two deformities can be seen: botany deformity and Swan-neck deformity. Extra-articular features, systemic features, which include fever, weight loss, musculoskeletal features like tenosynovitis, osteoporosis. In skin, we can see rheumatic nodules. Respiratory system, alveolitis, bronchiolitis can be seen, along with Kaplan syndrome and pleural effusion. In CVS, there is pericarditis, myocarditis, endocarditis. In hematologic and reticuloendothelial system, there is anemia. Neurological features shows compression neuropathies. Diagnosis is based on the joint involvement, serology, acute phase reactance, duration of symptoms. Joint involvement, if it is a one large joint, shoulder, elbow, hip, knee, or ankle, you can give it a 0. 2 to 10 large joints, it is 1. 1 to 3 small joints, it is 2. 4 to 10 small joints, it is 3. And more than 10 joints, it is 5. In serology, negative rheumatoid factor and negative anti-CCP is 0. Low positive rheumatic factor and low positive anti-CCP is 2. High positive RF and high positive anti-CCP antibodies is 3. Acute phase reactance, normal CRP and ESR, it is 0. Abnormal CRP, that is C-reactive protein, or abnormal ESR is 1. Duration of symptoms, less than 6 weeks, it is 0. And if it is more than 6 weeks, it is 1. So the total score, 6 or more, gives a definitive rheumatoid arthritis. Less than 6 gives a possible RA. Investigations include chronic pneumocytic pneumochromic anemia, ESR and CRP is elevated, rheumatoid factor is positive, anti-CCP is positive, which is more sensitive than RF. The ANA is positive. Synovial fluid analysis can be done. X-ray of the wrist, hand, feet shows periarticular osteopenia, non-proliferative erosions. Another feature of the synovial fluid analysis include the WBC count is 5,000 to 20,000 with predominant neutrophils, as well as synovial fluid glucose is low. So this can be seen in the synovial fluid analysis. Coming to management, the goals include relief of the pain, then controlling the inflammation, protecting the joint, maintenance of the function, control of systemic involvement. Pharmacological therapy includes analgesics, DMARDs, steroids, biologic agents, immunosuppressive drugs. Paracetamol, analgesics including paracetamol, opiates like tramadol, NSAID like diclofenac, aceclofenac, ibuprofen can be used, which can be both in oral and topical forms. DMARDs like methotrexate, hydroxychloroquine, sulfasalazine can be used. Steroids like prednisolone is usually effective. It is anti-inflammatory. Biologic agents like infliximab, adalimumab, and etanercept, which is anti-TNF drugs, as well as rituximab is also used. Immunosuppressive drugs like cyclophosphamide, azathioprine is beneficial. The other general measures include patient education and counseling about the long-term treatment, about the status of the disease. Then proper rest, proper exercise is essential. Then physiotherapy of the joints. Surgery includes synovectomy, osteotomy and arthroplastics.